Good evening, class. We're going to talk for a few minutes in this first module where this is basically a business ethics class that I'm going to gear more along the lines of healthcare ethics. Um, Healthcare is a business just like Starbucks, just like McDonald's, just like Bob's Steakhouse in downtown Nashville. Uh, it's an entity that is and most healthcare entities are profit maximizing entities. When we're talking about business ethics and we make that jump to healthcare ethics, it gets a little confusing because there are some uh, additional players in the healthcare field that impact ethics. If you think of Starbucks, you've got, the ownership. Let's say Starbucks is franchised, the owner is paid Starbucks franchise fee, and they're supposed to function along those types of I guess business practices that are outlined and then they're in their franchise arrangement. But at the end of the day, Starbucks, it's based on ethics, and depending on how ethics driven the ownership of Starbucks is going to have a kind of a trickle down effect to at least to those individuals working at Starbucks. And I think we'll see, and again, Starbucks, McDonald's, it doesn't matter. Nordstrom out at the mall, Neiman Marcus, Macy's, all of those companies are built on ethical policies and procedures. And we're going to get into that as we kind of work through these. And I want to grab, I don't know what I've done with my textbook. See if I can find it here. A little disorganized tonight, but this is the textbook that we're going to start out with, the Business Ethics Workshop. And the textbook, it's written by James Brousseau, and it's a Flat World publication. And I really like the approach that Flat World takes in most of their textbooks. You can get the hard copy, you can get an e-copy, multiple ways to access the information. But the thing I really like about Flat World is they provide, I don't want to say somewhat up to date, they provide up to date examples. They're not presenting the information in this Flat World format that is dull and boring. They've got up to date information. They have examples that they can walk you through. They have some test cases. And this particular workbook, or this particular book, the Business Ethics Workshop, it follows along those lines, similar to the other Flat World publications or the Flat World textbooks that I use over time. One thing that I'm going to do with this textbook is while it's a great textbook and it's one that you can purchase if you like, I'm only going to use this textbook probably for the first chapter. I'm going to pull the first chapter out of it because it goes into detail about business ethics just in general. And I think it's a good segue to use as an introductory chapter, an introductory module, as I start to go along the lines and move into ethics and ethical issues when it comes to healthcare, especially the consumption, the production of just healthcare goods and services in general. One thing that I did notice, and it's an issue with a lot of universities and been an issue for some time. Chapter 1 starts out and it's talking about textbook issues. I thought it was actually interesting that that's the example that they used, but they talked about, I think it was University of Alabama that they happened to be talking about. And the individual student there was upset with the way that the textbooks were being priced and the parameters around using the textbooks. And you see issues with textbooks a lot with universities. Think about at your current university. Think about the textbook issues there. If there are textbook issues, I'm sure that as a student you've experienced some angst when it comes to trying to secure textbooks. I can even go back to my graduate school days at Ohio State, and one of the things that we found was textbooks, especially in finance and economics, extremely expensive. Um, Even if you bought them at the used bookstores, they were a lot of money for those textbooks. And then, especially in graduate school, you were assigned journal articles to read, and you'd go to the business library and you'd get the journal app, and you got to the page where the article was supposed to start, and um, there was no article. Somebody had taken a looked like a razor blade and cut the articles out so that an individual student could use them and nobody else could get access to them. So there were some complaints there. And so some of the professors started, especially in graduate school, started moving away from textbooks and doing, because you read a lot of journal articles, they were putting together a portfolio of journal articles. They would send it to the print shop. They'd say, we've got, 30 students in this particular class. I need 35 copies made just to be safe. And you would go to the print shop and, as a naive student, I thought they were doing something special for us. Of course, you get over there that you had to buy the packet of journal articles, which I thought was maybe not as many dollars as you paid at Ohio State to go to graduate school. You would have thought, or at least I thought, that there would be some motive for the university to actually provide you that group of documents, and then not charge you for it. But anyway, that's I'm starting to ramble a little, but it kind of goes back to that first chapter in the text, and it's talking about textbooks and the price of textbooks and the way universities are, I don't say, and they actually refer to it as kickbacks maybe in the text. I'm not sure that that all universities are receiving a kickback, but there's probably some financial enumeration that the university receives for assigning a textbook for all students to use. I try to go in most of my classes. I try to go the cheap route. It's tough, especially going to graduate school and the cost of graduate school, and a lot of individuals, especially taking these asynchronous classes, are working, so they don't have a lot of time. They may not have a lot of extra money, and so I try to go the least expensive route, and that's why I say this is a really nice textbook. And if you want to buy it, go ahead and buy it. But I'm probably only going to use the first chapter out of it. And if you watch the video and you look at some notes I put out there, that may be all you need to do extremely well in this particular class. Because as I move down through the other modules, I'm going to be either grabbing information out off the internet, maybe from CMS's website. I'm going to be putting together some PowerPoint slides to put out there. I'm going to have the videos to walk you through the PowerPoint slides. So that's why I'm going to try to structure the class that way and make things as economically feasible as possible for the graduate students. But let's kind of move along, and we're going to jump in, and the textbook talks about ethics. It says providing reasons for how things ought to be. How things ought to be. Go back to your economics classes. When you talk about economics classes, there were normative statements and there were positive statements. Normative statements talk about how things should be, how things ought to be. Positive statements talk about how things are. You typically see normative statements, especially with public policy. Whether you're in healthcare or just in public policy in general, those tend to be normative statements. From an economic perspective, economists and financial researchers deal in positive statements, developing a hypothesis and testing that hypothesis, and it's a positive statement. So ethics goes back to similar to government agencies and public policy. They're more normative statements, how things ought to be. And the text walks you through about, I guess there were kind of three levels or three attributes when they talk about ethics. And the first one, values guide decisions. In ethics, the priorities selected to guide decisions. So it's the priorities that are selected to guide those decisions. So ethics in a corporate structure and a corporate culture is a guide to making decisions. And so typically, at least in a lot of the health plans I work for, there's been a senior management team. There's been, middle management, then lower management, and then everybody else is they're typically identified as individual contributors. And so for most health plans, again, senior team, you start hearing rumblings about here's going to be what we're going to do in the next year. So this is 2024. So in the fall of 2023, you would start hearing these rumblings, senior management. It starts trickling down into kind of the next level, and gets down to middle management. And it's here's what we think the goals are going to be in 2024, and here's how we're going to get there, and here's the strategy that they're going to put together to get there. So that's how they start, putting together the values that are going to guide our decisions. And under the values, they have to be clearly defined and well adjusted set of priorities. And these priorities need to be driven by metrics. And secondarily, it's what's worth seeking and protecting versus what we're willing to compromise or give up. And so what we would typically see in healthcare is, again, you hear the rumblings in October, November, and then all of a sudden in December, there's this big meeting, and, it's usually senior manager, kind of, so it's like, senior vice presidents, and then vice presidents, directors, and maybe even down to the manager level. You have a meeting, and all of the wheels stand up, or the senior vice presidents stand up, and you may have a presentation by network management, one by medical management, one by the CFO, one by the CIO, one by the COO of the operations, and you've got your CEO standing there, talking about how great things are, and they're laying out, here's what we're going to do this year. Here are the metrics we're going to measure it by, and so they do it in December because they want to hit the ground running in January. And somewhere along the way, inevitably, maybe at the end of Q1, that's right, maybe probably down in Q2, the wheels they don't start falling off, but they start to wobble a little. And when the wheels start to wobble a little, then you start to see the strategic plan and the ethics that are driving this strategic plan start to kind of wobble with the wheels, kind of wobbling. So, and you start to see the senior management team trying to determine what is worth protecting and what are they willing to compromise on. And if you've never been in that situation, which most graduate students taking these classes have been out in the workforce, and they've been in similar type situations. And I think they can probably relate to this, but it's just interesting to watch the dynamics and how they kind of, from an ethical position, how they move forward. And one thing that when you talk about healthcare, especially, things are significantly different if you work for a health plan that is for-profit. And when I'm talking about for-profit, I'm mostly thinking about health plans that have equity shareholders. I've worked for Aetna. I've worked for HealthNet, which is now Centene. I've worked for United Health, 3 equity-based health plans for profit, and they are being pressured to hit earnings per share by the shareholders or the stockholders or the equity investors, whatever terminology you want to use. Now, the last health plan I worked for was a Blue Cross Blue Shield health plan. It was a not-for-profit. And not-for-profit, the difference between for-profit and not-for-profit, to me, is more of a tax guideline. But even if it's a not-for-profit, they still want to make money because they want to ensure that they're going to be in business in the years to come. But they're not as profit-driven as a for-profit health plan. So a not-for-profit health plan, while they want to make money, they may spend a little more time with customer service. So they may spend a little more time with member satisfaction, or they may spend a little more time, and it's a different culture, definitely a different culture. And the culture for a not-for-profit as opposed to a for-profit, the not-for-profit may be more involved in community activities, may be more involved in assisting the disenfranchised in the area. So it's more of a culture. It's more of a tax categorization. It's more of a culture-driven when you're talking about for-profit and not-for-profit. But at the end of the day, what is important, whether you're for-profit or not-profit, especially in healthcare, is you have to have values to guide decisions. You have to definitely understand the facts. And ethics, people, and things involved in a decision have to understand the facts. Again, the meeting we have in December, senior management, looking at historical facts. And most of the directors and VPs, and even down at the manager level, understand historically where we've been, and they understand where we need to go to be successful. So driven by facts. And lastly, when you're talking about ethics, you're talking about constructing arguments in ethics showing how, given the facts, one action serves specific values better than the other activities, or better than the other actions. And I'm going to pause just a quick second there, or here, and I want you to remember, go back to your old econ classes. And I do this a lot in my classes. So, again, finance and econ guy. So I'm going to go back, but go back to especially your micro classes. Economics is a social science. Social science like anthropology, political science, psychology, social sciences that deal in choice. What drives individuals to make choices? And what sets economics apart from all of these other social sciences are 3 things. There's 3 pillars of economics that sets us aside. We talk about opportunity cost. We talk about self-interest and optimization. We talk about making decisions at the margins. And if you look at the third kind of aspect of ethics, it talks about in constructing arguments, it says showing how, given the facts, one action serves specific values better than the other actions. Now we're talking about opportunity cost. Ties it back to economics. And when you're talking about the conclusions that are driven by ethics, again, it's driven by clear values, it's driven by recognizing the facts, and it's based on building solid arguments. And if you have those 3 aspects and you can present those 3 aspects, then what you're looking at is the ability, especially of a senior management team, to drive that culture forward, to drive the ethics that they want everybody to abide by, and to instill that ethical behavior within everybody within that organization. And if you're sitting there in the room and you have to be really careful how you do this. But if you're sitting there in the room and you want to make an ethical argument with your senior management team that I guess goes along the lines as you may not agree with everything. So to do that, you want to have facts, you want to have values, and you want to have reasonings. Now, if I'm sitting there in December and senior management walks in and they say, we need to build membership in our health plan. We're going to have a new benefit plan. This new benefit plan is going to have zero copay. Zero copay. There's not going to be any member liability. Member won't have to pay anything out of pocket. And to get this type of benefit plan, though, we're going to have to raise the price. We're going to have to take the current price, and multiply it by 1.25 to offset some of this lack of member liability. Then you've got, so that's the actuary gets up and talks about that. And, then the sales dude gets up there and he says, we're going to have a new sales pitch to all these employer groups. And we've been providing them a lot of analytical work, and we've been going above and beyond what we need to ensure the claims process correctly. And we're going to do a new sales pitch. And here's going to be our new sales pitch. And they walk through the new sales pitch, and you're sitting there thinking, I'm not sure that'll work, but I don't have all the facts. And so I'm going to have to wait until I pull the facts together and then sit down and talk to the sales guy. The CFO stands up and said, as this actuary says, and the sales guy said, we need to build membership. We're thinking about expanding into some new counties. We're going to take and, we're going to roll out a new Medicaid plan in these counties, and we're going to take and roll out some additional Medicare Advantage in some other counties. And, you're sitting there, and at least I'm sitting there, and I'm thinking, we don't do that good a job with Medicaid, Medicare Advantage, as it is. Why are we going to roll it out into some new regions or some new counties? And then lastly, you've got the medical management guy stands up and says, we know we're in trouble maybe financially, and we know we need to build membership, but he says, I'm focused on health status. I'm going to roll out these new population health programs, and we're going to focus on health status. So those of us in the room, we're sitting there listening to this, and you can look around, and people are kind of, I don't know about that, and how much extra am I going to have to work? There's just a lot of things going on, and you can see the wheels turning as they try to put together arguments for or counter arguments against. And again, it's being driven by facts, values, and reasoning. And that's what you run into when we're talking about ethics, especially when we're talking about ethics in healthcare in general. One of the first things that this is, I guess this module. This is going to be this is video on the second module. The first module, I had you read Arrow's article talking about uncertainty and asymmetric information in healthcare. And so there were three main articles that most of us in finance and economics in one way or another had to read when I was in graduate school at Ohio State. If you were in public health or you were in healthcare, you read Kenneth Arrow's article, again talking about uncertainty in healthcare. Article written in published in 1963, and kind of at least in the 80s when I was in graduate school, talking about it was a seminal article of healthcare reform, because he published it in 63. Then along came Medicare, Medicaid. That was in 65. TRICARE rolled out a health plan in 66. 1986, I think. VA had been around for a while, but they started revising the way that they were going to provide healthcare goods and services to the veterans of the VA population. So that was one thing that, kind of one text that we had to read. If you were an MBA going down that MBA track, you had like The Art of War. I mean, that's, Sun Tzu's book on Art of War, and you even had that little tattoo on your arm that's little tattoo said Art of War. But required reading at an MBA. And then finally, if you were in the management track, you read Frederick Winslow Taylor's The Principles of Scientific Management. I mean, Academy of Management said it was the number one article that actually in the 20th century that turned around management style and for the management field of study. So kind of those types of books. Again, that's why I've got Arrow's article, and again, I think it's a great article, and I hope everybody enjoys reading it. It's I won't say it's a little convoluted. It kind of, it might not flow exactly like you would want it to flow, but I think it's got again, required reading, at least when I was in graduate school, and I think it's an article that everybody needs to read because it gives you an idea of what healthcare looked like in the late 50s, early 60s, and you can compare it, late 50s, early 60s, to what healthcare looks like now. It's a great comparison article. With that, I think I'm going to stop for a few minutes, and we'll come back and we'll take up the second component. Talk to everybody in a few minutes.